Bismillahirrahmanirrahim. Today we will discuss about the spondylo-arthropathy from the chapter of rheumatology. So spondylo-arthropathy is a broad term, and under this heading there are four conditions. That is the psoriatic arthritis, ankylosing spondylitis, enteropathic arthritis, and reactive arthritis. To easily remember these four conditions, there is a mnemonic used for this, that is PEER. Which mnemonic? PEER. Mnemonic is P E A R. Now we will see what is P, what is E, what is A, what is R. So P means psoriatic arthritis. E means enteropathic arthritis. Enteropathic arthritis. A means ankylosing spondylitis. A means ankylosing spondylitis. And R means reactive arthritis. R means reactive arthritis. Now, all these four conditions are also called the seronegative arthritis. Now we will see why this is called the seronegative arthritis. Seronegative arthritis. These conditions are called the seronegative arthritis because in these four conditions, if you will do the rheumatoid factor, this will be negative. And if you do the ANA, that is anti-nuclear antibody, this will be negative. And if you do the complement level, that will also be normal. Complement level will be normal. That is why these conditions are also called the seronegative arthritis. And these conditions are associated with HLA-B27. HLA-B27 positive condition. So the PEER is HLA-B27 positive condition. Okay. Now this condition can affect the spine. It can involve the enthesis. Enthesis means tendon and joint. And the inflammation of tendon and joint will call the enthesitis. So there will be low back pain due to spinal involvement. Chronic low back pain. There will be 1, 2, and 3. There will be chronic low back pain. It can involve the peripheral joints. All these conditions can involve the spine. They can involve the peripheral joint, that is hip joint and the shoulder joint, and can also involve the knee and other joint. It also cause enthesitis. Enthesitis means inflammation of the tendon and joint. Inflammation of tendon and joint. Tendon and ligament. inflammation of tendon and ligament. And it can also involve the other organ like the eyes, the skin, and the heart and lungs and the renal. So it can also involve the other organs. So this was a short introduction about the spondyloarthropathy. This is an umbrella term. Under this umbrella term, there are four conditions, that is psoriatic arthritis, enteropathic arthritis, ankylosing spondylitis, and reactive arthritis. And all these conditions share some common clinical feature. That is, all these conditions are seronegative arthritis, means rheumatoid factors is negative, Na will be negative, complement level will be normal. And all these conditions are HLA-B27 positive. And all these conditions also can involve the spine, they can involve the peripheral joint, they can cause enthesitis, that is inflammation of tendon and ligament. And also they can cause inflammation in other organ, like they can cause inflammation of the eyes, they can cause inflammation of the skin, and they can involve the heart and lungs and renal. So this was a short introduction about the spa. In the next lecture we will discuss about the ankylosing spondylitis, which is the prototypical form of the spa, and we will cover all these four conditions one by one.